Okay, so we're moving on to connective tissue. We've already done epithelial tissue. And remember, the first few questions we need to ask ourselves whenever studying tissues is number one, are the cells closely packed together? And if they are, we know it's epithelium. Then we go, how many layers is it and what is the shape? If they are made up of cells that are widely spaced apart, separated by an extracellular matrix, now we're talking about connective tissue. And connective tissue is the most abundant and the variable type of tissue that we find in the human body. And it has some important functions. It's going to connect organs to each other. It even connects the epithelium to the rest of the body. It gives support and protection, whether it's physical or immune. When we talk about immune, we have to talk about white blood cells. White blood cells are part of the immune system. And one of the type of white blood cells, we have part of the immune system. We're going to have T cells and we're going to have B cells. And the B cells are responsible for making plasma cells, and plasma cells make antibodies. So antibodies are part of the immune system. It says here that connective tissue is involved with the storage of energy and heat production, and that's primarily because of fat cells. Fat cells are called adipose or adipocytes. Adipocytes are fat cells, and fat cells store energy. When they store sugar, they're called triglycerides. And you can lower triglycerides by exercise because you need to expend energy. That's a great way of doing it. Adipose or fat cells also store toxins. So when we look at obesity or morbid obesity, this is the body's way of trying to protect itself because the individual is exposing themselves internally or externally to toxic environments. And the neural system and the liver doesn't want to be exposed to that many toxins at any given time. So it stores some of those poisons in fat cells. And little by little by little, those fat cells can rupture, sending the toxins to the liver and the kidneys to try and eliminate them. The thing about fat cells is that they increase until puberty. And this is why body composition is very important to try and maintain until puberty. I mean, it's always important. However, the thicker an individual is in terms of body composition at the time of puberty, that means that individual now has more fat cells to manage the rest of their life. It makes it more difficult. If the person is more lean at the time of puberty, this is an individual that has less fat cells that they have to manage for the rest of their life. Now, fat cells can increase in size and decrease in size. When they increase, it's called hypertrophy, and when they decrease, it's called atrophy. Adipose does protect us, right? I mean, think of spiders, right? I mean, and ants. You never see a morbidly obese insect because they don't have fat cells. And that's why when these insects are on farmers' crops that are exposed to herbicides and fungicides and pesticides, and they ingest those toxins and those poisons, those insects die immediately. But because we have fat cells, we can eat non-organic foods sprayed with all of these carcinogens, right? These herbicides and fungicides and pesticides, and it doesn't kill us immediately. Maybe slowly over years and years and years, but not immediately. Okay, so keep that in mind. Connective tissue is also and transport of materials in the body, and blood is connective tissue. It's just liquid connective tissue. Some of the characteristics of connective tissue. Most connective tissue is highly vascular, meaning it has a really good blood supply. So if it has a good blood supply, it can bring nutrients and it can heal it very well, compared to epithelium doesn't have the best blood supply. Connective tissue has a better blood supply. A few of the exceptions to that are going to be cartilage, tendons, and ligaments. So that if you sprain a ligament, it can take some time to heal because it's got poor blood supply. Think of rolling your ankle, it plantar flexes and inverts as you go down the stairs, and your ankle rolls in, and your ankle is swollen and all black and blue around the outside where that lateral malleolus is of the ankle. Takes a while for that to heal. The difference between tendons and ligaments, let's get this clear. Let's say this is a bone. We'll put a B here for bone. And let's say here's another bone just adjacent to it. We'll put another B for bone. When you have soft tissue structures going from bone to bone, holding them in alignment, those are called ligaments. But when we have a muscle, let's say this is a muscle, and this muscle is attaching to the bone, muscles attached to bones at this exact location, we call it a tendon. Wherever, we'll put an M here for muscle, where muscle attaches to bone, we call that attachment site, we'll put a T for tendon. So ligaments and tendons are not the same thing. Ligaments, when they're stretched past their anatomical position, we call it a sprain with a P. When tendons or muscles are stretched beyond their anatomical limit, we call it a strain with a T. Everyone okay? Let's make sure we're okay here. You guys can hear me okay? Guys can hear me okay? Okay, thank you. So strains and sprains are not the same thing. They involve different types of tissues. Whenever soft tissue structure gets stretched beyond their anatomical limit, if it's a ligament and it gets stretched beyond its anatomical limit, we call it a sprain. When muscles or tendons get stretched beyond their anatomical limit, we call it a strain with a T. Cartilage has poor blood supply. So when cartilage gets damaged, it just takes a much longer time to heal. Okay. So when we look at connective tissue, we're going to see that we have many different categories. Okay. Let's see if I can. The different categories are going to be connective tissue proper, supporting connective tissue, and fluid connective tissue. So we're going to be looking at these three primary categories. Blood is going to be the easy, fluid connective tissue is blood, so that's going to be the easiest when we cover it. When we talk about supporting connective tissue, right in the center, that yellow color, the supporting connective tissue, we think of what supports the human body. We have the skeletal framework, which is bone, and we have cartilage. So we'll talk a little about bone and cartilage. And when we talk about bone, we're going to focus on compact bone. There's also spongy bone, but we're going to focus a little bit more on compact bone. On cartilage, we'll talk about these three flavors: hyaline cartilage, elastic cartilage, and fibrocartilage. Okay. Fibrocartilage being the strongest, elastic, more flexible, and hyaline cartilage is in between most of the freely movable joints that we have, like the shoulder, the elbow, the wrist, the fingers. We're going to have lots of hyaline cartilage there. On the left, in the green, the connective tissue proper, we'll break them up into loose and dense connective tissue proper. Loose has these three categories: areolar, adipose, and reticular. And dense is going to have primarily regular and irregular, as well as elastic, but we'll focus a little bit more on regular and irregular. So let's look at the first, right? So if we go back, we have loose and then dense. So we're going to focus on connective tissue proper, loose and dense. So here's loose connective tissue where we have areolar, adipose, and reticular. And then we'll go to dense, which has dense regular, dense irregular, and elastic. So loose connective tissue proper, the areolar is going to provide us with padding, like a buffer, and it's going to separate your skin from the deeper tissues. So if you were to pinch the lateral side of your forearm, which is your thumb side, and you pinch it, you're going to separate your skin from the muscle. You can't really pinch the muscle. You're pinching the skin and the padding between them. So that's areolar. And there's lots of elastic fibers and collagen fibers there. Adipose is also loose connective tissue. Adipose, these are our fat cells, and they have nuclei that are off to the side of the cell. And this is an important feature because when we look at a cell that looks like this, with the nucleus in the middle, and then we have another one that looks like this, they both look like squamous cells. They're flat and irregular. The key is with a squamous cell, I'll put an S here for squamous, the nuclei are pretty much central. And then here I'll put an A for adipose, the nuclei are off to the periphery. Okay. All right, and reticular, this is going to provide the framework of support for most of your organs. When we look at dense connective tissue, there's dense regular and dense irregular. Now, dense regular is when we're going to have these fibers, like collagen fibers, that are going to be in nice, parallel, closely packed positions like this, right? So when we have nice, uniform, parallel, densely packed collagen fibers, those are dense regular. We're going to see these with tendons and ligaments. But when we're looking at the skin, let's say the dermis of the skin, we may have some like this, then we may have some moving in this direction, right? Then we may have some going in this direction. So skin, if you think about getting soft tissue manipulation or massage, a massage therapist or an LMT, a licensed massage therapist, can massage your body in different directions on the skin without tearing it and damaging it. And that's because of the direction of these fibers. When we look at muscles and tendons, studying the direction of the fibers helps us figure out how it's going to move. Elastic connective tissue we see with certain ligaments. Certain ligaments need more elasticity, like around the vertebral column. Around the vertebral column, the spine is very, very stable from an osseous standpoint, but very, very flexible. So going from vertebra to vertebra, from bone to bone, vertebra to vertebra, we're going to have ligaments that need to have more elastic connective tissue than collagen. It's more important to have more flexibility than strength and stability around those because the bones are already pretty stable. Okay, so now let's look at fluid connective tissue. Fluid connective tissue, we're going to focus on blood. Blood, we have erythrocytes, which are red blood cells. We have leukocytes. Leuko means white, so we have white blood cells. And then we have thrombocytes, which are platelets. And platelets are involved with clotting. They help us clot. When someone uses aspirin or baby aspirin, that blocks the platelets' function so that the person isn't clotting. But then they have difficulty clotting when they cut themselves and they bleed. They don't clot very easily. If a person is using aspirin, it thins the blood, so they bleed easily. When we talk about white blood cells, these are leukocytes. We have granular sites. We'll put a G for granular. And then we have agranular sites. We'll put AG. So we have granular sites and agranular. sites. And the granular sites, what we mean by granular is that the cell itself, if we look at the cell and then there's a nucleus, there's going to be lots of granules, lots of these little sandy-like granules that are stained different colors. So if the cell has granules, we're going to call them granular sites, and they are considered basophils, eosinophils, and neutrophils. So I call it BEN, B-E-N. Basophils, eosinophils, and neutrophils. Those are the granular sites. And then the agranular sites are just the opposite. There are no granules in the cytoplasm. Those are called monocytes and lymphocytes. When you get into the cardiovascular system in anatomy and physiology too, you're going to get more into these, into their structure and function. Right now, I just want to lay down some groundwork for that. And then red blood cells are erythrocytes. The main function of a red blood cell is to carry hemoglobin, and hemoglobin can bind to oxygen, to carry oxygen to different cells and tissues of the body. Lymph is basically the interstitial fluid that we have. That is the fluid that we find between the cells of the human body. They're going to enter lymphatic vessels and return back into circulation. All right, now we're talking about supporting connective tissue. This is going to be bone and cartilage. Okay, so cartilage is avascular, poor blood supply. Cartilage cells are called chondrocytes. Chondros, cartilage. And the three main types are hyaline cartilage, elastic cartilage, and fibrocartilage. The hyaline cartilage is the most common type of cartilage. We find them between joints. So where one bone and another bone meet, we're going to have hyaline cartilage. Whether that's between your humerus and your scapula, which is the glenohumeral joint, whether it's between your fingers, where you have your proximal and middle phalange, where your fingers come together, where you can bend your fingers, there's going to be hyaline cartilage there. It's that hyaline cartilage that degenerates with degenerative joint disease, also known as osteoarthritis. It's the hyaline cartilage that gets degenerative with that. Elastic cartilage, the elastic sounds like it's going to allow for more flexibility. And we're going to have elastic cartilage primarily in the back of the throat, where we have the epiglottis, inside the ear, the eustachian tube, and the external ear that is part of the helix that can flex and bend. So that's certainly more elastic. The hyaline cartilage, we're going to find at the ends of the bones, like we said here. We're going to find it around your thyroid, like your thyroid cartilage is also hyaline. Going around the trachea, we have tracheal rings going around the trachea, holding that and maintaining its shape. And right inside the nose, that nasal septum is also hyaline. Fibrocartilage, the shock absorber, when we think of fibrocartilage, we think of the intervertebral discs, the IVD, the intervertebral discs. Between each vertebra, we have discs, right? We've heard of people that have herniated discs, bulging discs. So that's the strongest cartilage in the body, is the fibrocartilage. The meniscus of the knee, the meniscus, the lateral and medial meniscus of the knee, that's also fibrocartilage. And then where your pubic bones come together, that's called a pubic symphysis. That too is fibrocartilage. So this has shown up on a past Connect or McGraw-Hill lab quiz in the past, which was really dragging the elastic fibrohyaline to the description. So if we were to say here that this type of cartilage is composed of a network of branching elastic fibers, well, that's pretty straightforward. Which cartilage is composed of type 1 collagen that forms thick parallel bundles? Well, the strongest cartilage is fibrocartilage because of its thickness. And these are mainly composed of type 1 collagen fibers, whereas type 2 collagen fibers that do not form thick bundles, that's hyaline. And because it's not so thick, hyaline cartilage can degenerate, creating degenerative joint disease or osteoarthritis. So they do make, some nutraceutical companies make some great supplementation for collagen fibers. So if you want to help to regenerate discs, we want to make sure that we're supporting type 1 collagen fibers. And when we're looking at other joints, we want to support type 2 collagen fibers for that hyaline cartilage. So we can help nourish patients in regenerating some of their degenerative joint disease, depending on what type of joint is involved. So if they have spinal degeneration for those discs, I'm going to try and nourish them with type 1 collagen fibers. If it's their shoulder joint or their elbow joint or their hip joint, we're going to try and regenerate them with type 2 collagen fibers. This has shown up before. This is cartilage cells. This is actually, these themselves are cartilage cells, those little raindrop-like things. But what they're asking for is what is the highlighted structure, which is the aqua bluish stuff. So whenever we're looking between the cells, that is the matrix, right? Or the extracellular matrix, but it's the matrix of hyaline cartilage, okay? When we look at bone, there's a few structures that we have to get familiar with and some terms. One of them is osteon, which we'll talk about. And we need to know what osteoblasts do and what osteoclasts do. Now, generally speaking, osteoblasts and osteoclasts, these are going to be antagonistic to one another because the osteoblast with a B is building up bone. Whereas the osteoclast with a C, see you later, osteoclasts are going to break down bone. So we have osteoblasts building up bone and osteoclasts breaking down bone. And these two have to work in harmony at the same rate. So as bone is building, then bone can be broken down, and then bone builds up, and then you break them down. That's proper metabolism. You make red blood cells, then they break down. You make hair cells, and then they break down. You make white blood cells and then they break down. You make skin and then it breaks down, and then you make new ones, okay? So osteoblast is an immature cell that forms the matrix of bone, and osteoclasts are breaking it down. It's no different than having construction workers to build up a kitchen, but first you got to break down the kitchen. You got to take down the sheetrock. You need a demolition team. So you need demolition first and then construction. Demolition and then construction. That's how bone development works. If you're breaking down faster than you're building up, that's osteoporosis or osteopenia, the breakdown of bone. Now, osteoblast, let's say this cell right here is an osteoblast, and it's pushing out matrix. It's making the cement, right? It's making the cement for bone, extracellular matrix. It's designed to produce that matrix. But if it's making the cement, what ends up happening is eventually the cement dries. And the osteoblast gets stuck where it is. It gets stuck in the matrix that it produced. And it's going to be hanging out in a cavity. I'm going to draw another darkened black circle. So now the osteoblast gets stuck in this cavity, and that cavity is called a lacuna. A lacuna, or lacunae. That's the cavity that it's now stuck in after the cement hardens. Okay? And now it's not called an osteoblast. Now it ends up being referred to as an osteocyte. Now it becomes an osteocyte. So it starts as an osteoblast, it makes the matrix, gets trapped. Now that immature cell becomes a mature osteocyte, which helps to maintain the bone. Okay. Now it's going to create these osteons. Osteons are a group of osteocytes in these concentric lamellae. Concentric lamellae basically look like what a tree looks like if you chop it down. Let's see if I can show you a picture of that. So here is compact bone. This part is compact bone, and this part is compact bone. Whereas here, both proximal and distal ends, those are spongy bone. But compact bone is this entire section from here to here. And then the inside, where you have the medullary part, that's spongy bone. Okay, but if you look at the feature of compact bone, we have these osteons, which is, here's an osteon, here's an osteon, here's another osteon, right? It looks like you chop down a tree, and it's made up of all these concentric lamellae. Okay, each of these are lamellae, each ring going around. Notice how bone is vascular, right? You could see right through the center of each osteon, there's arteries, veins, and nerves. That hole is called a Haversian canal. The Haversian canal has blood vessels going through, which is why when you break a bone, it hurts. I mean, you can bleed, and you do bleed. When you have a tumor of blood forming in bone, they call it a hematoma. Hematoma. Years ago, I had a hematoma from a jet ski accident. I was jet skiing on the North Shore and rode a huge wake, and silly me, right? I should have just let go and fall back. I didn't know. I was young. I was stupid. And I held on to that jet ski for dear life, and my knee hit the hull of it, and my face needed stitches on my chin. It was a mess. But when my knee hit that jet ski with such impact, it broke a little bit of the distal femur. I had some micro fractures in there, and I started bleeding inside the bone, and I could feel my heartbeat in my knee. That's how painful it was. Okay, so that's called a hematoma, is when you have a pooling of blood trapped inside bone, and it really hurts. It was not fun. The outside layer of bone is called the periosteum. That's important to know. So this outside layer is the periosteum, and that's where muscles and tendons are going to insert. Whereas the inside of the bone is called an endosteum. So you have a periosteum on the outside and endosteum on the inside. This is just a model of bone that I used to teach in a physical lab. But again, just showing the same structures. So if we look at number 1, that's spongy bone. And if we look at number 2, that's compact bone. If we look at number 3, the outside layer here, that's the outer part, that's periosteum. The periosteum. When we look at number 13, the inner part, that's the endosteum. When we look at number 6, that's an osteon, right here. That's an entire osteon. And the osteon is made up of these concentric rings called concentric lamellae, number 7. Okay, so those are some of the basic structures. Number 8 are osteocytes. They're a little bit tough to see from this perspective, so let's move on here. Here we're looking at what is this entire structure that's highlighted in this bluish aqua color. That's the osteon. The lacunae would be those hollowed out black sections. Those are the lacunae. The central canal would be right there in the middle where you have the blood vessels. Now canaliculi are these finger-like extensions. So if, let's say, this was the osteoblast, but it got stuck in the matrix it produced, so there's the lacunae, Now it's called an osteocyte. And we have these radiating finger-like extension. They look like spider-like extensions that make these canals that come off of it. Those are called canaliculi, like canals, canaliculi. So here, the highlighted blue section, that would be the lacunae. Okay. And you could see a little bit easier coming off of them, these spider-like linear webs, that network, that would be the canaliculi coming off of it. Okay, we'll take a break, and when we come back, we'll talk about the 3 different types of muscle.